Good morning. I'm County Executive Ken Jenkins, and we are here at the McKillen Office Building to make sure that we are kicking off and bringing awareness to Colorectal Cancer Screening Month and making sure that we have that awareness happening. So today we're going to have an opportunity to talk with various individuals that are engaged in our cancer screening analysis and making sure and treatment to move forward. And certainly this is a really great opportunity after we started this last year at the behest of Dr. Shalita Amler, our Commissioner of Health, our Health Department Commissioner, as well as all the work that has been done in the Cancer Screening Network to make sure that we're moving this forward. So this is so important that we're here today. So we're partnering with our hospitals and health systems countywide for Colorectal Cancer Awareness Month. March is a time to raise awareness about colorectal cancer, the second leading cause of cancer deaths in the United States, and to get checked if you are over 40 or earlier, depending on family and personal history. Colorectal cancer is the leading cause of cancer death in men under 50 and the second leading cause of cancer death in women under 50. Each year, more young men and women in their 30s and 40s are diagnosed with colorectal cancer. Screening absolutely saves lives. In addition to regular colonoscopies, the health department emphasizes that over half of the colorectal cancers are linked to lifestyle factors, including physical inactivity, poor nutrition, excess body weight, tobacco, and alcohol use. Protect your health by maintaining a healthy weight, staying active, incorporating more vegetables, fruits, and whole grains into your diet, steer clear of tobacco, and try to limit red and processed meats, sugary drinks, refined grains, and alcohol. So according to the American Cancer Society, racial and ethnic background also is a factor. Blacks have the second highest rate of colorectal cancer and are the most likely to be diagnosed later. Ashkenazi Jews have one of the highest colorectal cancer risk of any ethnic group in the world. Other risk factors include a family history of colorectal cancer or polyps, or personal history of polyps, colitis, Crohn's disease, type 2 diabetes, or inherited genetic conditions. Certainly, residents that are underinsured or uninsured can call the Cancer Services Program of the Hudson Valley. That number will be on the screen, 855-277-4482 for information and referral to free cancer screenings, colorectal, breast, and cervical, and diagnostic testing at centers throughout the county. With us this morning, we have a tremendous amount of support and information that's going to come to us from our Commissioner of Health, Dr. Shalita Amler. Dr. Amler.
Thank you. So as the county executive was saying, colorectal cancer, which this is Colorectal Cancer Awareness Month, is the leading cause of death in men and the second leading cause of death in women. And when caught early, colorectal cancer is very treatable. It can save your life by getting a screening or possibly the life of someone that you love. And remember that the most common symptom of early colorectal cancer is no symptom at all. And that's why it's so very important that everyone who's eligible for screening make that happen. And unfortunately, many people, especially younger people, are unaware that they should even be screened. So I'm joined today by leaders from a variety of our hospitals and healthcare systems throughout Westchester because we have joined together to share a mission. And that mission is that we want everyone in Westchester who is eligible for colorectal cancer screening to get screened. Today, the screening rate in Westchester is 65%. But we think that by working together to increase awareness, encourage residents to get screened, that we can raise that rate and that we could ultimately have Westchester be the best colorectal cancer screened county in the state of New York. And that is Dr. Sukla's dream. And we have joined him and Phelps and all of our hospital partners to try to make that happen. This month at our own county clinics, we will start referring patients for colorectal cancer screening. And to learn more about colorectal cancer and your screening options, you can attend one of many events that are scheduled this month throughout Westchester. You can visit our website at www.westchestergov.com/health. And we really want everyone to keep in mind the importance of this. And I do want to take this moment to thank Renee Recchia, who is here, all of the health department staff who've worked on bringing this information, especially our health ed staff, Heather McVeigh, and just the whole health department team who's worked very diligently on this. Thank you, Renee, and all your staff. Do you want to bring up our special guests?
Yes, you will.
Okay, so now I would like to invite Dr. Daniel Rodriguez, a third-year medical resident in the emergency medical resident, to share with us a little bit about his colorectal cancer journey. Daniel.
Hi, good morning, everyone. My name is Dr. Daniel Rodriguez. So it was kind of ironic to be diagnosed, or not ironic, I should say. It was a shock to be diagnosed actually at age 31 with colorectal cancer. Now thinking about it, my vague symptoms, feeling a little bit more tired, some weight loss. I was a very physically active person, going to the gym at least 2 or 3 times a week. I was eating what I believed a relatively healthy diet. And I only also had a little bit of blood when I had a bowel movement, and I thought nothing much of it. And then very shortly after, matching, finding out where I'm going to go for my residency, I sat down and I saw the entire toilet bowl painted red, and I was like, oh goodness, this is not good. Went to the local hospital. Wound up getting transfused 3 units and a CAT scan, MRI later, and I was having a conversation with the hospital's surgical oncologist, and they regrettably informed me that I had rectal cancer. So that was definitely a lot of information to take in. In hindsight, your vague symptoms, even if you don't truly think it could be something, it's still a very important conversation to have, whether it be with your general practitioner. If you do have a gastroenterologist that you can speak with, just speaking with them and having kind of an uncomfortable conversation, explaining some of your symptoms, and just advocating for your health and well-being. A very big workup later, no one in my family has any genetic predisposition to colorectal cancer. We did, my younger brother and I, my parents as well, we all underwent genetic testing, and I do have a gene altercation that predisposes me to familial adenomatous polyposis disease. So, but this wasn't something that was passed down from my family. It is a de novo mutation, a new mutation. And then being diagnosed at 31 years old, also, a lot of people told me, do you want to consider, you have to also consider your future if you want a family. So unfortunately, I made a very unilateral decision as well with, with my genetic mutation. I have a 50-50 chance of, bringing a child into the world with this disease, to have it at a much younger age. And I said, I'd rather not, play a very bad hand. So I made a very unilateral decision. Then I did also, I didn't save, I didn't freeze any sperm for future family planning, just because, again, 50% chance of bringing a child into this world with this disease. And it's not great. Same thing, no one really tells you about the treatments. Chemotherapy is it's not a fun time. The constant nausea, the vomiting, it's not great. All these, I could easily list all the uncomfortable procedures I've had, the medications and all this. Honestly, it, like, all this pales in comparison to sitting down, having an uncomfortable talk, with your provider, being able to be scheduled for a colonoscopy even. No one wants to be with a limited diet. No one wants to undergo a prep. Everyone's kind of heard like, oh, it left me feeling super weak or all this stuff. It's about a day of uncomfortableness just to kind of get a weight off your shoulders.
So, First, Dr. Rodriguez, thank you so much for sharing your own personal journey, but more importantly, because, again, making sure that everyone is aware of all of the challenges that can happen. And at 31 years old, to be able to have what was symptoms that you weren't even paying attention to, that it's so much more important that this awareness is happening. That's why everyone is here. So we thank you so much for not just sharing your own journey, but making sure that people could see that there's so many different things that they can do for themselves to be able to work through these things. And again, thank you so much for making sure that you're sharing everything with us. It's very difficult to do all those, and all of us either have family members that have been touched through cancer, and whether the screening and the challenges themselves. And again, all of us have been through this journey, but again, having the support around you and being a strong person yourself. So thank you so much, Doctor, for being able to share with all of us. At this time, we're going to ask Dr. Momenti from Northwell Health to come up here and give us some additional information. Dr. Momenti is the assistant professor in the Institute of Cancer Research at the Feinstein Institute for Medical Research. So, Dr. Momenti.
Thank you very much for the opportunity to be here today to talk about such an important topic. Currently, 150,000 people in the United States will be diagnosed with colorectal cancer this year, and 50,000 people will die of this disease this year in the United States. This is a sad statistic when we know that this is a highly preventable disease, and it's a disease that can be detected in its earliest stages. We know that the screening age was 50. It's now been lowered to 45. So the message for the public is the 45 is the new 50. A lot of people don't know the screening age was reduced. So it's very important, if you're 45 years of age or older, you need to talk to your doctor about getting screened right away. There's also a certain part of the population that should be screened at 40 or even earlier. And these are people with a family history of colorectal cancer and a family history of advanced colorectal polyps. And the second point is one that's often overlooked. It's one thing to get patients into colonoscopy, which is our mission. As Dr. Amler said, we would like Westchester County to be the #1 screened county in New York State. So we want people to get in for screening colonoscopy. We also want people to talk to their family members after colonoscopy, because generally after a cancer diagnosis, the entire family knows and takes action to get screened. But what the family member doesn't often do is talk to their relatives when they've been diagnosed with polyps. And this is also a very important risk factor. There are certain types of polyps that are prevalent. They're 2 to 10% of screening colonoscopies. These are polyps that are a little bit bigger, a centimeter or more, or have concerning histology. So after colonoscopy, if you have been diagnosed with polyps, you need to talk to your family members because they need to be screened at 40 or 10 years before your diagnosis. If you're diagnosed with one of these polyps at 45, your relatives should be screened at 35. And this is currently our only strategy to prevent early onset colorectal cancer, according to the national guidelines on screening. We just heard an incredible example of someone very young. We now know that 1 out of 10 cases or more are diagnosed with colorectal cancer under 50 in the United States. So early screening, learning your family history, not just of cancer, but of polyps, is absolutely crucial. Also, as a reminder, colonoscopy is the only screening test that prevents colorectal cancer by removing precancerous polyps. There are a number of other excellent tests that are home-based that you can do in the privacy of your home. Those tests can detect cancer early. And the reason that is so important is because when you detect cancer in its earliest stage, there's over a 90% 5-year survival and treatments are often more effective. So prevention and early detection are two critical tools to help mitigate this disease in the United States. And I just want to end with a quote from a cancer survivor who is now 5 years out from her colorectal cancer diagnosis. She always says that the pain and the inconvenience of screening for colorectal cancer, the prep, and what it takes to get yourself to a colonoscopy is a lot easier than the mental gymnastics and the burden and the challenge of a cancer treatment. Believe me, you will be more inconvenienced by a cancer diagnosis than by a cancer screening. So if you are 45 and you are ready to be screened, please talk to your doctor about getting the test, colonoscopy, or a home-based test that can truly save your life. Thank you.
So Dr. Molimenti is an associate professor at the Institute of Cancer Research at the Feinstein Institute for Medical Research, and we thank her very much for taking her time to come and share that message with you. And now I'd like to introduce Dr. Parul Shukla, who is Chief of Colon and Rectal Cancer at Phelps and Northern Westchester Hospitals for Northwell Health. Dr. Shukla.
Thank you. Good morning. And thank you to the county executive and Dr. Ambler for really gathering all the health system leaders here. As we heard, colorectal cancer is the second leading cause of cancer-related deaths. But what is important to know is it is actually a very preventable and treatable cancer when it's detected early. As we have been hearing, screening saves lives, but the challenge remains. Many people are still not getting screened. And that's where a coalition can make a difference. By bringing together what Dr. Ambler and the county executive have done today, healthcare providers, community leaders, policymakers, and advocacy groups, we can increase awareness, improve access, and break down barriers to screening. A coalition, as we have gathered today, would expand education efforts. We would ensure people understand the importance of screening and know their options. We would try to improve access by advocating for policies that reduce financial and logistical barriers, strengthen partnerships with local clinics, workplaces, and organizations to provide screening where people live and work. And we would also use data which we can gather to reach at-risk populations and address some disparities in screening rates. If we all work together, we can make colorectal cancer screening routine, accessible, and equitable for all. So together, let's build a coalition to make Westchester the county with the best screening rate in New York, because early detection and finding polyps will save lives. So thank you again, Dr. Ambler and the county executive.
Thank you so much. Now I would like to introduce Sarah Dodgton, Regional Director of the Cancer Services Program of the Hudson Valley, and she's going to say a few words about how they can help if you need to get a screening. So, Sarah.
Thank you very much. The Cancer Services Program of the Hudson Valley provides free colorectal screening as well as breast and cervical cancer screening for anyone who lives in New York State and is uninsured or underinsured. So if you are due for colorectal cancer screening, you're 45 and older, or you know about a family risk, you can go to your local federally qualified health center. In Westchester, that's Open Door or Sun River Health or Westchester Community Health Center, and you can talk to a provider about getting free colorectal cancer screening. It starts right there in your primary care provider's office, and we have wonderful partners across Westchester in all of the hospitals and all of the federally qualified health centers that are part of the cancer screening, the Cancer Services Program, to make sure that you can get those screenings for free. And again, anyone who lives in New York State is eligible for this coverage if you do not have health insurance or you are underinsured. Thank you. Thank you very much.
So thank you, Sarah. So I do want to encourage parents to have a conversation with their adult children about the results of their own colorectal cancer screening. If you have a history of colorectal cancer or advanced polyps, your children should get their own screening done by age 40 or 10 years before you were diagnosed, whichever comes sooner. I just had my own colonoscopy, and I have been coaxing members of my own family to do the same. I can tell you that having had one 10 years ago, it was a totally different experience. It's miraculous what they've done with the prep and just making you more comfortable during the procedure. So if you had bad experience in the past, I can tell you that things are totally different today than they were even 10 years ago. So I would really encourage it. So if you're in your 40s, now is the time to speak to your doctor about your family history, identify your risk factors, and learn about how lifestyle changes can reduce your risks, and also the right time to schedule your screening. If you are at increased risk of colorectal cancer, your doctor may want to start screening even earlier. And while some risk factors, as the county executive was telling you, are beyond our control, it is never too late to adopt a healthier lifestyle. Being overweight, inactive, eating a lot of red meat or processed meat, smoking, excessive drinking can all increase your risk of colorectal cancer. So it really can help to eat a healthier diet, exercise regularly, and to avoid alcohol and tobacco. Residents who are uninsured or underinsured can call the Cancer Services Program of the Hudson Valley, and that number is 914-488-6400 to learn more and for referrals to free cancer screening throughout Westchester. And Renee, do you want to come up and just say a few words and thank your staff for all their hard work? Heather McGill has done and her staff have done a tremendous amount to make all of this happen. And they're kind of the unsung heroes. So I just wanted to bring Renee up so that she gets an opportunity to be recognized, because her and her staff have really worked diligently to get this done.
Thank you, Dr. Amler. And again, I really want to thank all of our partners. This would not be possible without working with all of you. Also want to acknowledge Karen Helfinger, who really is our public health person who really helps put all this information together and press events. So thank you, Karen, for all your work with this. But again, I think the message is clear. Please don't hesitate in getting tested. That information will help you to move forward and stay healthy. And again, I want to thank our county executive for making this a priority as well.
Thank you. Thank you, Renee. Okay, so now we want to recognize some of the physicians that have joined us here today and ask them to come up so we can recognize just their efforts. Dr. David Jerome from St. Joseph's Medical Center, Dr. Gregory Pontone from White Plains Hospital, Dr. Ashok Chupra from St. John's Medical Group, Dr. Shireen Pius from Westchester Medical Center, and Dr. William Higgins from New York Presbyterian Hudson Valley Hospital. We are really appreciative of all of their partnership and all of this. And now I'm going to bring the county exec back up for last words.
Thank you, Dr. Amler. And again, first we wanted to thank everyone that spoke earlier. Certainly Dr. Rodriguez, who shared his story with us and his cancer journey with us. Dr. Momenti from Northwell Health, who also explained and gave us some additional more detail on things that we should be able to continue to do as part of the network to make sure that we're getting those screenings done, making sure that Westchester is going to be number one in the screening categories. And then certainly Dr. Shukla, who reminded us to continue those things that, yes, everyone's going to come back up, and we're going to make sure to show everyone that's been part of this tremendous network, and certainly Sarah Hodgson, that was going to make sure that we work together with the Cancer Screening Network through federally qualified health programs, through all of the networks that are here. It's so important to see that the different medical centers and providers that are here and that aren't here. We know that there's more, and they're all working together to make sure that we can deal with this, especially in March, where we have colorectal cancer screening opportunities. I can't remember when I had mine. It hasn't been 10 years yet, but certainly making sure that we continue to do it, and the additional information that if you have the results, and making sure you share those results with family members to let them know to be able to do that additional screening to do that thing. So again, we want to thank everyone that participated and spoke today, and make sure that everyone is aware that March is colorectal cancer screening month, awareness month, but more importantly, to make sure that you share this information with friends, family members, etc., to make sure that everyone is trying to do those analysis early. I don't recall it being that bad, by the way, Dr. Amler. Right? So whatever it was, whenever it wasn't that bad, right? So I think I had a really good sleep out of it. So right. But other than having someone drive me back and forth, I don't remember it being a very negative experience. So again, I think that as Dr. Momenti pointed out, that whatever inconveniences that would be, that is certainly more inconvenient when you have to support members in the family to go through whatever treatments that you do. But the reality is that we want to make sure that everyone understands those opportunities to be able to make sure that they're having the best lifestyles possible. As an elected official, sometimes all those things that you mentioned that were bad things that could lead to colorectal cancer, I'm probably doing all of them bad. So we're going to continue to work on making sure that we're working on a better, healthier lifestyle, making sure people get around and exercise more and eating healthier, all those things that I'm probably not doing. So again, at the end of the day, we want to say thank you for everyone being here today, to remind everyone that it is Colorectal Cancer Screening Awareness Month, but more importantly, that the opportunities to get that screening is free for those people that are underinsured or uninsured, etc. So again, I'm County Executive Ken Jenkins. Thank you so much for watching. This information is on all the Department of Health's website as well, to point to the colorectal cancer screening team, awareness team, and to make sure that we'll continue to move forward. Thanks a lot for watching. Have a great day.